Anyway, so it doesn't look like as if I'm saying all of the words. Dr. Janelle will be putting us through every necessary information we need to know as regards diabetes and how it can be properly managed. This is the issues on IKD 106.1 FM. I'll be your anchor for today, and my name is Okpeyemi Adebambo. The studio lines would also be very much available for you to make calls, for you to call us and talk to us as regards matters in line with our conversation, which is managing of diabetes. Management of diabetes is what we will be talking about today. So if you have questions during the course of the conversation, you can do well to call us on our studio lines 0904 081 1061 or 0904 082 1061 as we together talk about diabetes and how it can be properly managed. You can also send in text messages or WhatsApp messages directly to 0904 082 1061. That is 0904 082 1061. And we will do well to read out your messages immediately we get them. We go on this very, very short break, and then when we return, the issues begins properly while we talk about management of diabetes. This is a very common one, and we need to have every necessary information as we get diabetes. I'll be right back after this short break. And of course, talking through that conversation, some of the areas where we will be looking at will be us understanding the basics, right? Us understanding the basics of diabetes, and that is why it's important that we do all of this analysis one after the other, when we talk about what exactly is diabetes, and how it can be properly understood, by layman. There are a lot of talks around diabetes. There are some talks you hear and you want to wonder, is this still the same diabetes they're talking about or another illness entirely? Right? There are some things you might not even know, you might not have heard before about diabetes. We will be doing justice to that during the course of the program today, after which we will progress from understanding the basics of diabetes. We would also be talking about some of the causes, right? And that is why you need to listen up today to the program. We will be talking about some of the causes of diabetes and the risk factors that are also involved, right? So the big question is, what exactly causes diabetes, right? That answer will be given to us today by our medical practitioner who will be talking to us and joining us in the studio, as well as management and treatment, right? Like I told us earlier, when you talk about diabetes, it can be managed, it can be treated, but then the chances of it being cured totally, it's another thing entirely. So when we talk about diabetes, what are the measures to which we can manage diabetes? What are the measures to which we can treat diabetes? Will be another side to which we will be looking at today, as well as the complications, and preventions. Like they say, prevention sure is better than cure. Prevention, they say, is far, far better off than cure. So what are some of the preventive measures? If you're not living with diabetes, then you can prevent having diabetes. What are some of the things you need to do to be able to avoid, having this illness called diabetes? So we'll be talking about the preventive measures. We'll be talking about some of the complications as well. And then most importantly, we will be talking about lifestyle and long-term care, which is very, very germane. If you would agree with me, we will be talking about lifestyle, which is very, very important. When you talk about diabetes, lifestyle is very key. Lifestyle is very, very paramount, as well as a community and public health care, the roles they play. And that is why we will be asking some questions from our medical practitioner today, helping us to understand how exactly it works within the medical sector in Nigeria, majorly Lagos, as a matter of fact, here in Ikorodu. How does it work with General Hospital Ikorodu? All of these areas we will be looking at today on the issues as we talk about diabetes, the management of diabetes. This is a very common one. This is very rampant. This is very, very common amongst our society today. We're talking about this very common diabetes. We will be talking about how it is caused, what exactly are some of the reasons to why some persons battle with diabetes. All of these and more we will talk about again after this very, very short break. But when I return, we get straight into the conversation of the day. You're welcome back, and thank you so very much for still joining us on the issues today. And like I told us, because we do not have the luxury of time, we will be getting into the conversation straight away. Clockwork from here, it's exactly 14 minutes gone past the hour of 11, as we will be talking about diabetes today that is the management of diabetes in our society today. Now, don't also forget that I told us that we will not just be talking about what diabetes is all about. We will be talking about the causes of diabetes, the risk factors. We will be talking about the management and treatment, as well as talking about the preventive measures to diabetes. If time will permit us, we might also briefly talk about the lifestyle and long-term care for diabetes. With us in the studio this morning, like I did the introduction earlier, a medical practitioner who sure knows his onions well from General Hospital Ikorodu, in person of Dr. Ginald, will be talking to us as regards diabetes. Good morning, and thank you very much for joining us this morning.
Good morning. Thank you for having me.
It's good to have you again in the studio, and this time around we hope that we will be able to cut through all the corners that we intend to talk about. We are talking about diabetes today, and let's start with its simplest form. When we say diabetes, what do we call diabetes? How best can we understand diabetes?
Okay. Diabetes mellitus is a disease condition that has to do with the body management of blood glucose. Really, they are not things essentially like the simplest aspect of it or the big aspect of it. Diabetes is diabetes, and yes, it can occur both in the young and in the old. It can even be caused by pregnancy. It can occur during pregnancy for some people, where we call it gestational diabetes mellitus. So essentially, it's a disease that is preventable, manageable, but it is not curable. Let nobody deceive you, please.
Diabetes is not curable. When you say let nobody deceive you, I was already going to ask that, but we do hear that they say, oh, when you do it this way, you do it that way, you can cure diabetes.
No.
Diabetes is not curable.
As it stands in the level of the current level of science currently, no, not yet.
All right, you've heard that from a medical practitioner, so don't be deceived. Those are his words, actually. So don't be deceived. Diabetes mellitus is not curable for now. Now let's talk about the big parts, which is the common signs. Now we hear diabetes. What are some of the signs of diabetes? When we see these things, should we say that, oh, this is diabetes knocking at the door?
All right. So diabetes, it is important to know that some people may not be symptomatic. They may not have any symptoms yet. Maybe they just went for their annual check and they found out that their blood glucose is really high or it is impaired. So one can know through that. However, a lot of times people have symptoms.
Okay.
It's most of the times they have what we call nocturia, a situation whereby somebody who normally before wakes up maybe once or not at all or twice to urinate in the night, starts having 4, 5, 6, 7 times urinating, and it's not as if this urine will be small. They will be as normal volume or even higher. That's one. Then there are some people who will have the symptoms of we call polyphagia. They'll be eating a lot. So that's there. Some people lose weight during diabetes. Then if people now start having complications, some people would not know. They'll be presenting in the hospital for the first time with complications like even stroke, because diabetes, we found out that diabetes work in synergy with blood pressure to make stroke occur faster. So that's that. Some people will present with loss of consciousness. They go into coma from either hyperglycemia, which is a blood glucose that is not well controlled, being excessively high. Patients lose consciousness, they bring them to the hospital, or even hypoglycemia. Some people would have been diabetic anyway. Maybe they took drugs excessively, they go into hypoglycemia. That one can also cause coma, and they present like that. Also, we may find some people presenting with signs of kidney failure. And they may just be discovered for the first time to be having diabetes. So these are things that have been the one that occurs commonly, even before these heart attack, stroke, kidney failure, people will start having numbness in their hands and feet. We call it paja. Some will even be saying, that they want to take blood tonic or blood water capsule and things. No. Once you start having numbness in your hands or feet, please go to the nearest hospital and have a doctor check you up. They may be telltale signs of diabetes mellitus.
You know, when you say these things, you know, I want us to talk about one very common assumption. First of where they say, oh, diabetes, if it is diabetes, then it's a woman thing. It's for only the female, only the women are affected with this illness. I want us to clear the air on that. How true is it that diabetes is not a thing for the male gender, just the female gender? Because that's another, I don't want to say rumor. How true is that statement?
Yes, it's a rumor. It's a ruse, and it's very, very incorrect. Very untrue.
Very, very incorrect.
So diabetes occur in both genders.
It occurs in both genders. At what age can one start saying diabetes might be knocking at the door? There are some illnesses that they say, oh, it affects only children, like the measles and the likes. And when you hear diabetes, they say, it's for the elderly ones. So before you can start having diabetes at the age of 60, 70, start getting ready, diabetes will be knocking at the door. How true is that too?
Well, it is not true. Diabetes is divided into two.
Okay.
It's more than two really, but for this discussion, let's limit ourselves to that.
Good.
We have type 1 diabetes, then type 2. Type 1 diabetes tend to occur in children more.
Wow.
People who are 20 and below, sometimes even between 20 and 30. Type 1. That one, for the purpose of this discussion, let's just say, okay, it is the one that is being used to be referred to as insulin dependent. Is only treated by insulin injection to have effective control. That one occurs commonly in children, younger people, while the type 2 occurs in older ones, from 30 thereabouts or more. So people can have that as well. So it occurs in children, it occurs in males, it occurs in females, and in older ones.
The two major angles at which I would like for us to really spend enough time before we wrap it up on the show later during the course of this program will be how it can be prevented. You know, like they say, prevention is better than cure. How it can be prevented, and for those that are already in this circle, how it can be managed for them. Before we talk about the preventive measures and then we talk about how it can be managed, let's talk about how the diagnosis look like. How can one diagnose that? Okay, what I'm currently in right now is diabetes.
Okay, essentially it's a diagnosis that will be done at the laboratory.
Okay.
Yes, by the time the patient presents at the hospital, the doctor will ask specific questions that occur commonly in diabetes. If those questions are there and the patients are having those symptoms and after examination found the signs, then we send to the laboratory. They will do what we call glucose check. Okay. There is fasting blood glucose check. Then there is 2 hours postprandial. Okay. Then there is a test we call glycated hemoglobin. That one is used to check the level of sugar control over a period of 3 months or more. Okay. Why that fasting blood sugar checks what the blood sugar level was or is at that moment in the morning. Then 2 hours after taking what we call 75 milligram or 75 gram of glucose, checking thereafter, then they check, that one will be 2 hours postprandial. Those two will be compared. Okay. So if they are high, we take the patient that has been diabetic. Now, if fasting is higher than normal and 2 hours after, we call it 2 hours postprandial, is normal, we call that one impaired glucose tolerance. That means that person is having a higher risk of developing diabetes. There's management for it, which is dietary control. So essentially, that's how we diagnose it. Diabetes mellitus.
Thank you. That will bring me to the causes now, because you've said, okay, it could be diagnosed this way, it could be diagnosed this way, and there are ways to go through that with all of those tests. Now, let's talk about what exactly causes it. We know that, oh, if you have this illness, they tell you maybe the kind of food you're eating. You have that illness, they tell you, oh, maybe it is hereditary, it is in the gene. But for diabetes, what causes it? Is it what we eat? Is it what we drink? Is it hereditary? What causes diabetes?
It is hereditary. It's genetic. It runs in families. However, even those who are not having it, it's important we manage our intake. Okay. Because what we take in enables us gain weight, and weight gain is one of the risk factors to developing diabetes mellitus. Also, of course, directly, what we also take in aids development of diabetes. So that's that. Now, in terms of prevention, lifestyle modification essentially, and healthy eating.
Mm.
Healthy eating habit is really, really important. And of course, we won't be saying eat this, eat that, because people tend to misconstrue what the doctor or the professionals say. We advise them to see a dietitian.
Okay.
We put them through the pace where things will be done properly. And we have them in General Hospital Ikorodu to help with that. It's a whole department, and it's viable. Very, very.
Okay, thank you for that one. Now, this will bring me down to management now, which is another very important part. Talking about the management, how can one manage? Because you have said it earlier, you said it is not curable, right? But it can be managed. How then can one manage diabetes mellitus?
Okay. The first and the best way to manage is actually to be attending a clinic.
Okay.
Let the doctor be seeing you, and of course the doctor knows the range at which the blood sugar has to be, whether fasting or random or 2 hours postprandial or what have we, or even if we choose to go by the way of glycated hemoglobin, the doctors know, and they will be giving these drugs as needed. Yes, if the blood sugar, if the patient's blood sugar is now normal, or maybe, okay, we say it should be between 80 and 110, that's for fasting, and the patient is having like 82, 83, the doctors will know that we should reduce the dose of the drug, or even stop some in some cases. So essentially that's the way to manage it. Then lifestyle modification. In addition to the drug, we should manage our exercises are important, not weightlifting, not heavy lifting, but once to make our body know that, okay, you need to shed this weight. Exercise will help us shed weight, but also help us manage our diets as well. So all these things together help. Now, it's important to know that there are, where our fathers have agbo and things like that, about preparation, but they really help. And most of these agbo, even the ones that can help, some of them have chemicals in them that are injurious to our system, to our body, either to the brain, the heart, the kidneys. We would not know because we don't put them through scientific checks. So how do we know what can injure us? So it is not advised people go on agbo. And we've had countless number of patients who have gone on agbo. They are presenting with complications. Liver has gone haywire. The agbos can cause kidney failure. We have cases like that. If somebody is having diabetes, which is a very, very serious precursor, is very serious situation for the kidney, which can cause kidney failure on its own. Have high blood pressure too, which can cause kidney failure. That person now has gone ahead to be taking agbo or herbal preparation. It's as if one is adding petrol to a burning fire. It becomes serious more. So essentially, it is always better to see a doctor, then follow the doctor's instructions. And in some cases, sometimes if there is no doctor, it's better you see a trained nurse who will help. Of course, they will know their limit and refer to the nearest doctor. So,
still talking about management of diabetes, I want us to talk about another angle. You said now, Dr. Junal, that it's okay to always see a doctor or a medical practitioner who will put one through. But we have cases, it's always advised sometimes that, you can always do these checks at home. Your blood level, your sugar level, and all those things. You can do these things at home. How often should one, check oneself as regards diabetes? Is it supposed to be every 3 months? Because there are always duration. For instance, brushing your teeth, you are the medical practitioners that tell us make sure you brush twice daily, in the morning and at night before you go to bed. Eat 3 square meals. Everything always comes with duration. So for diabetes, how do one need to check? How do we check for diabetes?
Now, for somebody who is not a diabetic,
okay,
we advise annual health check. And during that annual health check, they will check at least once a year to see whether the sugar level is high or not. For people who are diabetic, we advise them to check not every day, at least once or twice a week before seeing the doctor, and making sure they have the record of these checks to show the doctor that these are the things that have been going on. This has been the trend of my blood glucose level, to help the doctor. So essentially, once a week, twice a week for those who have diabetes. For those who don't have it, they can check once a month.
Okay.
Every 3 months, every 4 months, every 6 months, or annually.
As often as possible.
Yes.
There are no restrictions.
No restrictions. However, for people who have the family history, maybe it's happened in one of their uncles or their fathers, they should be checking at least twice a month.
Twice a month at least.
And in addition to practicing lifestyle modification.
Yes.
That's exercise, eating healthy, essentially.
Asking this question of poorly managed diabetes. Now, you just said it that it is hereditary. It could be in the gene. If your father has it, you might have. If your mother has, you might have. There are tendencies that generations to come would still have it. But then, this alone has brought some people to the point where they just say, oh, Ashimani Lebi is a family thing, you know. So because of that, they just feel comfortable. Oh, my mother had it and she died at the age of 95. Oh, our forefather had it. Poorly managed diabetes. What are the implications? Because some people no longer take it serious and they don't want to go extra mile in caring for themselves because they believe it's a tradition. It will happen to me, it will happen to my children, and I will still live. What happens to people that don't take this thing called diabetes serious?
Now, thank you.
Yes,
the problem with us in this climate is the fact that we don't have records. A lot of 444 people might have died from complications of diabetes even early, but we do not keep records. So that's one downside to our system. However, we've seen 40-something-year-old coming down with kidney failure, and the only incriminating factor is diabetes mellitus. That's sad, that's tragic. So having a family history should not be seen as a death sentence or as someone giving up. It should be seen as a clarion call for someone to take one's health serious. It must, not should, it must be seen as such, in the sense that that should enable them to be monitoring themselves, like I said earlier, that at least once a week, if there is a family history of diabetes, so that you'll be able to know that you'll be able to know when this is starting to show for real and start management. If it is diagnosed early, if the management starts early, chances for that person to live very long is there. Our fathers then, they were eating healthy. Most of the times they pluck fruits and food from the farm,
raw vegetables,
raw, and eat for that day. But what do we have now? Canned food, highly processed food. So we are not in the same situation in terms of what we're taking. We are in a very precarious situation right now. So we should see ourselves as such. We are not like our parents. They eat healthier, while we eat most of the time actually junk. We go to all the eateries or lots. Yeah, that's what we eat, junks. So, and those things don't help. They don't help. So it's important to know.
Yes, still talking about these measures. Now, I am going to ask this question as regards how bad can diabetes be? Because I know there are people who don't see diabetes as a big deal or an issue. How bad? There are some illnesses you hear that, oh, it has gotten to its worst. This is the worst stage of this illness. But if it is for diabetes, at what point do you say this is worse? This is very terrible. This is bad. It has gotten worse. And this is the peak of it for diabetes. At what point?
Diabetes mellitus are the points where the blood sugar is becoming difficult to control. For somebody who is going to the hospital who is seeing the doctor, attending clinic, at the point where the sugar is getting difficult to control, you know that you need to, even the doctor would have proposed to admit and manage it well. That's one. Then again, at the point where signs and symptoms of complications start showing. These complications, I am compelled to talk about them now. Let's go this way so that people will understand. We start from the head.
Okay.
It can cause what we call cerebrovascular disease.
It could get to that point.
Yes. So, still on the head, it can cause blindness, what we call diabetic retinopathy. Then if we leave the head, we go to the heart. It can potentiate occurrence of myocardial infarction, which we call heart attack. That means working in conjunction with high blood pressure. It can cause that. Then if we go to the abdomen, that's the tummy side, it can affect the kidneys. causing kidney failure.
Mm.
And if we leave that, we go to the legs, the hands, it can cause what we call peripheral neuropathy, whereby I talked about having numbness and other things. Then it can cause peripheral arterial disease, whereby our arteries and veins will become problematic. They will be having a lot of inflammation going on, getting blocked, and in the long run, they lead to some what we call sores. Sores lead to ulcers. So at the point any of these signs or symptoms of this complication starts showing up, it's getting really precarious, and one should take heed, getting to see a doctor or see a specialist, as the case may be.
Thank you very much for that one. We'll see if we can take one or two calls. We're gradually wrapping up the conversation today on the issues while we talk about diabetes mellitus, which is very, very common. 0904-081-1061 or 0904-082-1061 are the studio lines where you can call us and be a part of this conversation, or send us text messages or WhatsApp messages to 0904-082-1061. Let's take this first call from here. Hello to you. Good morning. Good morning, sir. We can hear you. We can hear you loud and clear. Good morning, sir.
So my name is Isa Mustafa from Alagbado. You see, if you wanted to put end to diabetes, I'm a lucky survivor of that disease. The type of diabetes that I find myself when I was young, it's called the robo. The one that used to come up from person sheet. I know they go back again. So I'm lucky. My village got a lot of herbal something. You call it Okoibaba. I don't know how my father did it. And they saved me from that disease, because no survival of that kind of situation. The major causes of diabetes in today is poor food malnutrition. So when I was a student too, I lucky to be a family of bushers who used to eat meat well. But I realized in those days that only 3% of us who eat well, our weight talented in the class. So food malnutrition have caused diabetes problem. That causes memory problem, height problem. For the students, I make them unable to read. It complicates teaching system in both primary, secondary, tertiary institutions. That is why we are trying to eliminate all this kind of poor economy. Those who have right to operate goodwill, and the one that have sense of humanity, that can give, that have the ability to give. The current willpower, they lack such ability. Their fundamental right is to pay the bill of trade as well as the loan. But today, we don't enjoy that. All the money of the world trade is being converted to dollars.
Thank you, Mr. Mustafa. God bless you too, Mr. Mustafa. So, I think you want to say something to that, Dr. Jinan.
Thank you, Mr. Mustafa. Thank you, sir. Yes, I think what he was trying to say is what we said earlier about diet.
Yes.
So eating healthy and ensuring that we don't take in junks and things like that. However, Mr. Mustafa went a little political, a little economic. No wahala. It'll be fine. We all will work hard, and Nigeria will be fine.
You know, I also want to ask a question. Okay, maybe let's take this call from Mr. Larry before we go ahead. Hello, Mr. Larry. Good morning this morning, Mr. Larry.
Our doctor, he has
Thank you, sir.
dealt with this issue. But first, before I even thank them, I need to thank them for calling on strike last week. They're not in this studio. Not putting all we that can afford a big medical thing to call off. And I'm back to the topic. Doki has said a lot, and I think I was actually jotting down when he was talking. Some things that I don't know also as well. He has showed more light on it, and I think from now onwards, I can watch what I take in and what I do and everything to avoid diabetes. So my own contribution is just for him that keep yourself booked, guys, and thank you for coming and educating some of us that listen. Thank you very much, sir.
Thank you, sir.
Thank you so very
Thank you,
much,
sir.
Mr. Larry. He's there commending and saying well done to our doctor who has done well today to talking to us as regards diabetes. Now, I want to ask, our first caller there said something like he had diabetes and he survived it. Looking at what you said earlier, that diabetes can only be managed. Are there similar cases, or have there been any case where somebody would just, oh, by grace, by chance, I used to have diabetes, but now I no longer have diabetes, I'm free? Are there cases like that, Dr. Jinal?
As it stands in health management, in sciences, it is not curable. We don't know this man. We don't know what he truly had. It may not be diabetes. However, we are not saying he's not telling the truth. But I will advise him to please not be far from his hospital, his doctor, and ensure he's properly diagnosed. As at this time, no, it is not curable. It is only manageable.
How long does it take before diabetes becomes so bad? You know, there are some illnesses that stays for long in the body. You know, because what he's saying is making me think that, oh, could the thing still be, if at all, if it was diabetes, I'm thinking, does it have a duration to how long it stays, or is just something that it could be there for a long time? There are some illnesses, you doctors will say, it could be there for 20 years and you might not know. Is it same with diabetes?
Yes, it is the same with diabetes. Like I said, some people, earlier, I said some people are not even having any symptoms at all. Maybe they just went for a health check, annual health check, and they found out that your sugar is high. Both of them, you are diabetic. Of course, they will now do other tests to confirm. Once that is confirmed, we start treatment.
Let's talk about some of the challenges, Dr. Jinal. We want to thank you very much for being a part of this conversation. In the next 10 minutes, we will be wrapping up. Let's talk about some challenges. One, financial challenge. Some persons will tell you, we have heard that, oh, a diabetic patient will always use drugs. They will always tell you to take drugs. You are always on medication for the rest of your life. And this alone scares people away from even coming close to any hospital or any medical facility. How true is it that, the management of diabetics could be very, very expensive because you have to live on drugs for the rest of your life? How affordable is the management of diabetes?
Yes, it's not cheap.
It's not cheap.
It's not cheap because we should tell people the truth, especially around the dictates of the economy now, which is not a result of the last 2 years. It is as a result of management, let me not say mismanagement, for over 30, 40 years. Now we have a government in place who is trying to manage the situation, and while trying to manage it, it's important for us to know that things are not going to become superb overnight. We'll have to give some, take some. However, it's important for the government to also know that people are going through a lot financially and find ways to help them out. Personally, I believe if we, the health professionals, what do we call them? The organizations, NGOs, not NGOs like that. What do we call them now? I've forgotten. Really, if we can sensitize government to the plight of people with diabetes, government will know and they will find a way around it. Maybe we have people who are having HIV, getting drugs freely, TB, they're getting drugs freely as well. And it is important to also note that most of these people who have diabetes are retirees, our aged part of the society. So really, government holds it to take care of them. Also, our philanthropists, we have a number of them who are doing well. They're helping, especially in General Hospital Ikorodu. Our rich people in the country too can always come in to help. Drugs are not going cheap. It is important for us to know and help us so that we don't just start losing our people. We're losing them seriously to death, diabetes, and some other conditions which are manageable and can really be salvaged if adequate financial input is provided. There's nothing stopping diabetics also having free drugs, if not all the time. at least. Maybe,
just like that of tuberculosis and
exactly.
the likes.
Even if it's just half a month, then they pay for the rest. I know government can find ways to handle things, and Baba is doing well. So,
all right. Having said that, you have a word of experience within the four walls of medicine and the General Hospital Ikorodu here. I want us to do a scaling now. Let's do comparisons. How common is diabetes? We just hear that people have diabetes. How common is it? For instance, General Hospital Ikorodu here, can you say you have about 5 to 10 patients that is currently managing diabetes, or maybe they are not even up to 10? Because we only hear of diabetes, we don't see the people that suffers it.
Okay, I didn't come with facts, and no, I'm here with facts, but not with figures right now. However, on an average month, we have wards where we manage them. At least each month, at least 40% of the patients on the ward, sometimes maybe as high as 60, are having diabetes.
Monthly?
Yes, and
60
complications people on the ward. So, and I'm in that department where we manage diabetes, so it can be as high as that. So imagine a hospital that's having 10 beds, and every month you have between 4 to 6, sometimes 4 to 8 of those patients being diabetic. And diabetes doesn't occur on its own. It oftentimes walks, especially in the people who are 40 years or more, walks along with high blood pressure.
Never walks alone. Diabetes never walks alone.
Liverpool people.
I didn't say that. Dr. Gerard did that. So you heard that from me.
Any Chelsea fan will say that.
Anyways, maybe I will support that statement as a Chelsea fan. But however, maybe Nigerians should also watch out for Chelsea this time around, because we know it's going to be a very, very big one for us.
We're bringing the fire.
That kind of thing.
They're all in trouble.
So we just told at that time to let you know that Chelsea will be doing so well. The signs are written all over the world. Yeah, we have a message here on WhatsApp where this person is asking, does diabetes does General Hospital have the equipment to test diabetic patients?
Yes, we do.
Okay.
We do. In every way you can think of. Yes, we do.
So this answer, this person is already beefing us. I think he's an Arsenal fan. He said, what do you mean by Chelsea? Oh, okay,
I'm a true blue man.
Blues for life. No apologies. Blues for life. Blues for life. So let's talk about General Hospital now, since this message here is talking about, do you have the equipment and facilities which you have said yes to? How does it work? With everything we have said here today, which is more like an awareness, some persons out there might have these repentant hearts to say, okay, maybe let me also walk down to General Hospital or any health facility to check myself too as well. Am I diabetic? How does it work? Are there opening days, or you can only come on Mondays and Wednesdays? How is it like? What's the structure like for General Hospital Ikorodu?
Okay, we work 24 hours. Our laboratories are open 24 hours. So how it works, the patient will come to the hospital. We'll first see a doctor in general outpatient department. That we call it GOPD.
Okay.
Of course, before seeing them, you would have seen the nurses obtain card. They would have done the vitals, blood sugar level, then blood pressure. Then the person would now go to see the doctor. Tell the doctor the reason you are there. If you're having symptoms, if you're not having symptoms, if you just want to check yourself, the doctor will now request for the investigations you need to do. And they will ask you to take the card to the laboratory. Once you get to the laboratory, because we're on EMR, you just give them the card.
Okay.
Once they have your card, they have your number, they slot it in. It will bring all the tests that you're supposed to do as recommended by the doctor, and they will take the sample, tell you when the results will be ready, and they will tell you which day you go and see the doctor. That's it.
Simple as that. There's another message here. This might be the last one before we wrap it up today on the show, and we might take in one more call before we go on 0904-081-1061. This person is concerned now, maybe because of what we said earlier, that the tendencies of one having diabetics is actually very high if the parents or it's in the lineage of that family. So this person is asking this simple question, Dr. Gina. If my father or mother has it, does it mean I will also have?
No, it's not always cast in stone.
Okay.
It doesn't mean you will have. It is just an avenue for you to be observant and take care of it. You can actually prevent yourself from having it. So we should see it as such. Do your regular blood sugar check and make sure you follow the lifestyle recommendations. Make sure you follow the diet habit, and you'll be fine.
Okay, yeah, you've heard that. You've heard that. The fact that your parents have it, or your grandparents have it, does not mean you might necessarily have it, but the chances are also there. It's important that you do well to check yourself. Just get checked. Get checked. And for those of you that are currently managing it, keep doing your routine as it should be. It is not affordable, like you've heard, but then it's important that you go through the medical process. Hello to you. Thank you very much, Mr. Friday, for calling. Good morning.
We appreciate your what am I going to call it? Your
Dr. Guest.
Yeah, the doctor in the studio.
Thank you, sir.
For the lecture. Yeah. I want to, though I missed some parts when you are talking because of how I'm listening to it. So I want to know, is it transferable? What I mean is, like HIV now, when you have a cause or someone has a cause, you contact it from the source. Is it such?
Is it contagious? Yeah. All right. Okay.
No, it is not, sir.
Okay. Stay with your radio. The answer is straight. It is not.
Yeah, it is not. It's not contagious at all. It's not an infection. No.
So it should not be a case of you hear this person has diabetes and you don't touch me, don't touch me.
No. You can hug them. You can even kiss them. No wahala.
Nothing would happen to the person.
Yes, nothing.
I think that's also another question that came from there. Very, very important. Is it contagious? Because sometimes these things brings about some sort of stigmatization. So this person has a diabetes, you are looking for ways to just avoid that person. It is not contagious
at all.
At all. You can be free with them. You can do whatever you want to do with them.
Yes.
It is not transferable. That is for Mr. Friday. So before we leave the studio, Dr. Jinal, what would be your parting words to everyone out there listening to us at this time to wrap up the show as regards our diabetes?
All right. The thing to say is eat healthy. Ensure you do your exercises. If possible, avoid alcohol. If you must, reduce it significantly. And have your blood sugar checked regularly. With those, one should stay healthy.
Thank you very much, Dr. Jinal, for joining us in the studio this morning. And for those of you that would want more, please do well, feel free to walk down to General Hospital Ikorodu, and they will be there to attend to you. As a matter of fact, let me give you open check. When you get to General Hospital, ask for Dr. Jinal. He will be there. And if he says from who, tell whoever that you heard his voice on radio. And that is why you're looking for him. But then, aside the jokes, somebody will always be there to attend to you at General Hospital Ikorodu. It's important you always get yourself checked. Health, they say, is wealth. This is how far we can have it today on the issues on IKD 106.1 FM. I am Opayami at Dibambo. Until tomorrow, same time, same station. Stay healthy. God bless Nigeria. God bless Lagos. God bless Ikorodu.
Amen.